So there are two ways of giving acupuncture. One is by very low frequency stimulation, and that will release endorphins. At high frequencies, it works through serotonin. There's recent evidence that a synapse such as number 11 onto 12 can only follow at low frequencies. There's evidence even in the bath. If you take some guinea pig intestine and stimulate it in a test tube, if you stimulate it at higher than 4 per second, it will no longer release the endorphin. So you have to use low frequency stimulation for endorphin. But at high frequency, you still get analgesia, but this time it's working through number 15 to 14 and the serotonin pathway. And we've shown that if you abolish the serotonin mechanisms, you will abolish the 200 hertz analgesia. Now this diagram also shows some more, it includes number 19, which shows you the direct pituitary CSF endorphin connection, because people are now challenging the other pathway, number 18. Because of the blood-brain barrier, it's now thought that endorphin cannot cross from the blood to the brain, but it could go directly into the brain through this dotted line. And finally, for completeness, there are two other pathways, but they have not been very well studied. That is, the hypothalamus contains cells, number 20, which secrete endorphin directly to number 12 this way. There is a direct neural pathway which acupuncture possibly activates. The evidence for that is not so good yet, but we put it in here for completeness. And another pathway, number 21, is currently under investigation in Paris. Besson has shown that if you if you cause pain somewhere in the body, it will feed into number 21 and in the form of a negative feedback activate number 13, which will then go down and via serotonin block pain. So there's a sort of a negative feedback. This is the pain line. You cause some pain, it'll go up to the brain, but it'll also feedback, and this will cause negative feedback or inhibition of further pain. So according to that story, one pain can inhibit another. But whether that has anything to do with acupuncture is not known at the moment. First of all, it comes on very quickly within a fraction of a minute and only lasts a few minutes, whereas acupuncture, as I've already said, takes 10 minutes to get started and lasts a good half an hour after the treatment is over. This pathway here is a very fast one and may not have anything to do with the usual kind of acupuncture. Although there's probably many different forms of acupuncture, and it's premature right now to describe only one mechanism and one phenomenon. I'm sure it's a mixture of many things. What are some of the possible clinical implications of this diagram? Well, first of all, as I've indicated before, putting it in the muscle is useful because you'll then be activating these particular fibers. We've tried putting the needle subcutaneously and not seen results, although there are some clinicians who do use subcutaneous acupuncture. I feel that this particular system involves muscle stimulation. Not to say that there aren't other nerve pathways and other nerve systems. Another implication of this whole story is that if you look at pathway number 9, you're really talking about local circuits. And we haven't really explored this carefully, but generally speaking, these are intrasegmental, that is, within the same dermatome, within the same myotome. And this certainly would explain the function of stimulating Auger points, tender points, referred pain points, and so forth, because they're all generally within the same segment. Any of the local points as well that have been described for particular diseases are generally near the disease itself, and so are probably in the same segment, working through number 9.